Hi everyone. Thanks for joining me for this new episode of Nepal Now, the podcast where we highlight different ideas and actions to move the country forward. I'm Marty Logan. Thanks to those of you who filled out the poll on our last episode about Jumli Marcy Rice. It's available if you listen on Spotify, and I post a new poll and a question there with each episode. This one was tricky. Do you think the growing trend of selling nutritious crops instead of consuming them is good for farm families? That contradiction was reflected in the poll's results, with most people choosing they didn't know if it was a positive or negative development. If you're listening on Spotify, look for the poll and a separate question that you can answer about this episode. And no matter where you hear Nepal Now, you can always send me a comment or question to martylogancoms, C-O-M-M-S, @gmail.com. Okay, on with today's chat. I've noticed a huge difference in publicity around the topic of mental health since I returned to Nepal in 2016, compared to when I lived here from 2005 to 2010. The subject is highlighted in the news media more regularly, and certainly on social media. Also, there seem to be many more organizations offering mental health education or treatment, both to individuals and to organizations. For example, a couple of years ago, I interviewed someone from an NGO that is creating quiet spaces it calls counselling rooms in schools in some pilot districts of the country. You can find the link to that episode in the notes to this show. Growing recognition of the importance of mental health might be one of the few positive results of recent disasters like the 2014 earthquake and the COVID-19 pandemic, notes today's guest, consultant psychologist Sneha Agarwal Chaudhary. Still, it is certainly alarming that the suicide rate in the country continues to rise steadily. Sneha and I also chat about a few popular perceptions of mental health counselling, like the cost and confidentiality. Then we turn to discuss particular groups of people who make up a chunk of the audience of this podcast. These include young people in general, as well as those who leave Nepal temporarily to either work or study. I think the main takeaway from our conversation is, if you're concerned about your mental health, find someone you can talk to. As today's conversation includes talk of suicide, please take special care while listening. And now, my chat with Sneha Agarwal Chaudhary. Sneha Agarwal Chaudhary, welcome to Nepal Now podcast.
Thank you so much, Marty, for having me here.
We're definitely going to be talking today about things that people can do to cope with some of the challenges they face in their lives. But first, I wanted to ask you, there's been a lot of awareness raising in Nepal in recent years about mental health. And also many more organizations, I noticed, are offering different types of mental health services, both to individuals and to organizations like schools. Have you yourself, as a professional, seen a difference in how the general public approaches mental health? And are people, do you think, more open to speak up and to seek help?
Yes, Marty, I would definitely agree to this. There have been a lot of awareness program going around recently. I would say in my experience, before COVID, it was like a major taboo. People would not understand, what a mental health problem is. I would have clients to whom I would have to explain that, okay, this is not a physical health issue. We are going through something which needs a different kind of attention. However, what I believe during the earthquake time and COVID time, people started talking a lot about mental health issue over social media and a lot of mediums, and I think that brought a little spike in creating some awareness about mental health. So, yes, people are aware. People do come to me and say that I'm going through anxiety. help me out. However, I still feel that, we can do a lot in creating awareness about mental health. It might be available to the cities. However, I feel that the rural cities needs more awareness about this.
Yeah, that definitely makes sense. As in everything,
Yes.
the rural areas just
Yes.
don't seem to get
Yeah.
enough or their fair share.
And yes, of course, this May month is also known as Mental Health Awareness Month. So, I think it's a great idea to talk about mental health.
I didn't know that, actually.
Yeah.
Okay.
I wanted to share it with you. It's
Hey,
just
perfect timing.
Yeah.
That's very good to know. One thing I hear a lot is people using the term depression and depressed. I'm depressed. And when they do this, kind of bell goes off, and I think, well, maybe they're not depressed. They're feeling poorly. They're feeling low. They're feeling not happy.
Yeah.
But there's a difference between clinical depression and feeling low. But is that something I should tell people, or should I just keep quiet and acknowledge that they're just not feeling good, whether or not it's clinical depression or feeling poorly?
I think it's always a good idea to talk about how you're feeling to your loved ones. I don't say that you just go out in public and if you're not comfortable, go on a public space and talk about your emotions or how you're going through, or if you are diagnosed with a clinical depression or any other mental health problem. But it's always a good idea to share your feelings and how you are going through. Maybe sometimes just venting out might make you feel better.
Right. Okay.
Yeah.
Just going back to that first question, I'm happy to hear that, increased awareness is a result of people being involved in highly stressful situations. You mentioned the earthquake, and then, of course, COVID-19.
Yeah.
So in a way, though, those are silver linings of very bad situations. At least people now are talking about some of the, the mental impacts of pretty bad events that happened. I think one of the things that might prevent people from speaking out or taking the next step in seeking help is that they worry that financially it's just not something they can afford. Maybe it's for rich people. How do you address that if someone asks you, maybe I'm feeling bad, but I can't afford counseling, for example? What would you say?
As a psychologist or any other mental health professional, this is also one source of living for us. We have put an effort to be a professional. I don't say, yes, definitely seeking a therapy or a counseling service is not like going to a physician. The physician or any other doctors would be spending like 5 to 10 minutes with you. However, a mental health professional is spending almost like 45 minutes or maybe more than that with you. So that's again, I would say it again goes to the awareness part. People, if they are going through a physical health issue, they would immediately go and seek help. However, if they're going through any emotional imbalance, or like you mentioned, they're feeling low, they say that, okay, I'm feeling depressed or anxious, they would not seek it as an emergency help. I do get a lot of clients who say that, ma'am, it's difficult for us to afford the charges. As a therapist, my help to them is that, okay, I can give you some fare off, or maybe if you're visiting me thrice, you can just pay for twice, things like that, just to make sure that the client gets what he or she needs.
Yeah, that makes sense. And I wasn't trying to say that
I know.
it's too expensive.
Yeah.
I think my question was more, is there any other kind of support for people, financial support for people who themselves can't afford out of their pocket? So do government hospitals offer?
So yes, there are a few government hospitals. There are a few NGOs, INGOs, where you can go and seek help. Yes, definitely. There are addiction centers where you can, rehab centers where you can go and stay for 2 to 3 months, or how long you want to stay.
So it's a blend of this
Yes.
kind of personal counseling
And,
that you offer, which I'm guessing is usually a number of sessions.
Yes.
And then these things you listed at government facilities
Yes.
too. Okay, great. And one other question before we start to talk more about, I think, some of the groups of people that are among our listener profile. I want to ask you about, people studying or working overseas and the kind of pressures, particular pressures that they face. But before we talk about the challenges certain groups of people might have, confidentiality. I've heard some people here in Kathmandu say that I won't go to a counselor because Kathmandu is a small place and people talk to one another, and I don't want other people to hear my business, sort of thing. What kind of guidelines or rules are there for mental health professionals like yourself to ensure confidentiality?
See, I think confidentiality is a major key. So, for example, if someone is visiting me for a therapy session, then I am not forced, or I'm not obliged to talk about his or her personal matters, or whatever he or she has been discussing to me during the session, even to his or her family member, or to the partner, or whomsoever is accompanying them. If we get a hint that the person is having any suicidal thoughts, then we need to inform the patient party or the client party that, the person is having some kind of thoughts like this, so you need to keep an eye over it, or maybe a check over the medicines if someone is going through. Yes, definitely, as you said, Kathmandu is a very small place, so people do get scared. I do get a lot of clients who their first question is that, I hope this is the most confidential thing, or confidentiality would be maintained. So that's again a part of awareness. I would say, we cannot speak about it even to my partners or to any other doctors in the hospital, unless we are working as a team, and that certain issue would help the other doctor to diagnose or help the client.
Right. Okay. And I guess for you, it's also how you keep confidentiality becomes part of your reputation.
Yes, exactly.
So you don't want to risk that as well. So, like I said, I wanted to talk about, certain groups of people. I'm not quite sure how to describe that, but groups of people in society who might be facing particular challenges or mental health risks. And the listeners of this podcast are a good chunk of them, maybe half of them, are between the ages of 18 and 35, 40. And a lot of those people I know are overseas. They go overseas, many for temporary purposes only. Some are migrant workers. And another big group of people who travel are students. So I wonder if you could talk first about maybe those two groups, or together as one, within that age group, people who are away from home, maybe missing their families, having culture shock, under a new set of pressures. What kind of things can you, in general, obviously, because we're not talking about individuals, but what types of things can you counsel them to look for and to try to do to maybe help their situation?
So, once the person decides that he or she wants to go abroad, either for studies or for employment, I think the process of reaching there is also not easy for everyone, I would say, So I'll just share a personal example, like 2 days back, one of my house Didi, she said that her son wanted to go to Malaysia. And she was like, he's asking for certain amount of money, and she was like, I can't afford it. And then, of course, she wanted him to go, and he wanted to go. So apparently they found a solution that, she had some jewelry, and that's how they managed going there. So, of course, once they reach there, they are separated from the family, the separation anxiety, the cultural shock, and many more things are there which they are facing. However, what I feel, the process starts from here itself. The anxiety or the emotion that I'm going to be away from my family for certain year or certain months. And for example, if a male is going or traveling abroad for employment, then the woman is left behind. If they're married and if they have children, she stays with the family, taking care of the child as a single parent, the financial stress, everything is on her head, So the process of traveling abroad and reaching there itself has a lot of stress. The documentation, the health checkups, where again, we do health checkups before going abroad, however, mental health checkup is not a part of it. Why?
Yeah.
Yeah, So, and once they are abroad, they are away from their family, they have to, for example, if a student, he's studying, but most of them try to work as well, and that's again a stressful thing, However, some of them are able to cope with it, and some might need a lot of time or attention to cope with it. So sleep is again an issue, getting adjusted, financial stress, so many things. A situation which might be very small or which might look very tiny to any one of us would be playing a very major role to that person. So it's very difficult to say that yes, these are the particular factors that might affect a person. Of course, we can form a guideline saying that yes, these are the factors which can contribute to their good mental health or affect their mental health, I would say.
Right, okay. So if there was some sort of mental health evaluation, let's put it that way, of people going overseas, I'm assuming it would include some sort of, like you said, advice or guidelines on how to stay mentally healthy. Because we get those all the time for physical health, as you mentioned earlier, right? Again, very generally speaking, some of those might be, like you said, try to get sleep, try to take time off your work, whether it's physical office work or whether it's school work. Try to regularly talk with people by Zoom or something.
Definitely.
I mean, what other types of things might fit into that advice?
Okay, so yes, of course, eating well, sleeping well, making time for yourself, making, for example, if you are staying in a different country, a lot of Nepali people travel abroad every year. So, for example, if you're in Australia, you can make sure that if you know someone over there, or if any of your relatives are staying there, and friends, anyone. So, you can meet them on your weekends, because weekdays would be busy. So these are small ways to, cope with your stress, or not even stress. If you're not stressed, just to, kick the happy hormones, I would say.
No, that's a good idea.
Yeah.
And I think that brings up an interesting point, which is you don't always have to be dealing with a condition or an illness.
Yes.
You just need to be, again, this idea of mental health, being mentally healthy the way you are physically healthy. So you'll go play football on the weekends and also take time to sit back and listen to your favorite music or something.
And you just find your hobby. It's not important that you need to be in group to find some self-time for yourself. Just discover what's making you happy. Or maybe giving 10 minutes of that self-care, or that 10-minute of activity that could, bring happiness to yourself and make you feel that, okay, yes, I did something for myself in this day, and, you might feel achieved. For example, if you enjoy drinking tea, so when you're making the tea, make sure that you're into the process of making the tea. You are just mindfully making the tea. You're adding chai patti, you're adding sugar, then the water is getting boiled. You just enjoy every moment of it, maybe.
Just out of curiosity, do you know if any agency or government office has ever considered producing this kind of advice for people who go overseas, or is it just it's completely outside of their thinking about how to prepare people when they leave the country temporarily?
We do have a lot of organizations abroad itself, where they can seek professional help. However, I feel like some of my patients who consider doing online counseling, or when they are back to Nepal and they prefer doing individual counseling, the major issue they face over there is the cultural thing, and maybe the language, and the access to help is not very easy for them. So that is one of the reasons that they come back to the country itself and seek professional help.
Right. I mean, I know because I've been here for a long time, and I'm married to a Nepali. The Nepalis are very people-oriented people, right? They like, most Nepalis, I should say, I think, like to have lots of people around and have contact with people almost continually. And to be in a situation where you can feel, where you're more likely to feel isolated must be tough if you're not used to it.
Yeah.
Right? And you're already under you're in a different environment, facing different challenges, and that might start to kind of pile up. Yeah, build up. Exactly. Now let's talk a little bit about a younger age group. Mm-hmm. And these are people who, I guess some of them are also overseas because they've just left maybe to study the final years of high school or first years of college and university. But let's say teenagers and young adults, and it's a very difficult time. You're in between the ages of being, still in some ways a child officially, but then you're a teenager and sometimes you get treated like an adult, and the whole maturation process is happening. And so these young people are under, I think, even sometimes more pressure than most of us. I last week or 2 weeks ago heard a story, and it seems to happen far too regularly, of a young person who, without any sort of explanation, out of the blue, as they say, took his or her life, I don't remember now, without any warning, and just shocking everyone, friends, family, school. What do you say to those young people who are feeling all of these pressures of being a teenager and a young adult and don't know where to turn and don't know how to ask someone for help?
I think it's a big question and a lot of questions inside the big question.
Take your time.
Okay. So first, talking about the pressure which they feel when they go overseas, the freedom. I think, you are inside your family, you're into your family's shell where you don't have to cook, you don't have to worry your room is cleaned or not, and so many things on your daily requirements, and you go there and you have everything to do. So like you mentioned, the maturity process itself creates some kind of stress. Some people are able to cope with it very easily, and some people do take time, feeling isolated, that okay, yes, you are excited to go overseas. You are happy. You took the decision. However, when you're there, then you realize, okay, this is how it works. I am all alone by myself. I don't have my family to talk. I don't have my friends. So feeling alone, feeling isolated, homesickness is one of the first factor which affects them. And then again, as I mentioned earlier, if you're going there for further studies, yes, I have a pressure to do well. I've come abroad. If I have taken a loan, I need to repay the loan. And if you're going there for an employment opportunity, the pressure to send back the money to the family, these all are small things which might add up and bring a stress to an individual, and maybe the individual might have difficulty to cope with the stress. However, that doesn't mean that the individual will get down into a mental health problem. It could be situational. So, when I'm going away into a new condition, into a new environment, I would have some discomfort initially. However, after some period of time, if I'm okay with it, that's completely okay. However, if you feel that, no, I'm not able to sleep well, I am getting into drinking habits or any other habits, whenever you think that, okay, no, I'm getting into this, it's better to talk to a professional. And if you still have a dilemma, no, I don't think so, it's a mental health problem, I don't need professional help, there is no harm talking to your family members, to your close one, or to your loved one, or any of your good friends. It's always better to talk. I came across an article, and it was done by Nepal Labor Migration Report 2022, which said that a total of 10,666 Nepali migrant workers have died abroad in between 2008 to 2022. And among them, 1,187 migrant workers have committed suicide.
Wow, that's a big number.
Yes, that's a big number. So that goes to the second part of your question, where you mentioned about a person who committed suicide. I believe the person who is undergoing through this thinks that he or she has no choice except taking his or her life. We don't know how much effort they have been putting from their side to talk about it, to be into a good situation or to be out of that situation. We don't know anything about it. What I would say is, if you ever think or if you ever have any suicidal thought, talk to your loved ones, or there are a lot of helplines. You can just dial them. And if you're staying overseas, even there you have a lot of helpline numbers. Okay, I'll just quickly share one thing. So, for example, you can easily diagnose diabetes. Yeah, you just do a blood test, you get the borderline numbers. If you fall within that, you're good. Any changes up and down, you need help. I wish we could do something like this for the mental health as well. If we don't have a diagnostic manual, we do have a lot of tests which would help us to diagnose whether a person is having depression or anxiety. However, the person needs to assess himself first. Any changes, if that is happening to you for a very long period of time, it's better to go for help.
Right. Yeah, that makes very good sense, and it's such a good example. I think you can test for diabetes and so many other things very quickly, especially these days, but you really can't do the same. And so that made me wonder. Then maybe the second best or third best, or something that at least you can do, which is positive, is try to create what they call a supportive environment.
Exactly.
Right. So kids, for example, learn by example.
Yeah.
Learn by seeing and watching the people around them. So if your parents and other adults talk to one another about how they're feeling or the problems, the pressures they face, there's a better chance that the kids are going to develop the same sorts of behaviors. They're modeling, right? Yeah. So if you get that at home, at school, among your peer group,
yes,
that's kind of not the ideal, but a very positive situation.
Yeah. So nowadays there are a lot of schools they have counselors in their schools where students can go and talk about themselves or whatever they're going through. I have seen there have been a lot of organizations who support their staff by, giving them an environment where they can go, and they tie up with a mental health organization, and you can visit them if you need help. And I see there have been a lot of organizations who do workshops or awareness program into their organization once in a while, so that people can know that, okay, these are the symptoms or these are the problems that might need a different attention.
Right.
It's not related to physical health. It might be mental health as well.
Yeah. So these are Nepali organizations?
Yeah.
Yeah, well, that's...
I mean, a lot of companies, I would say.
Yeah. That's positive, and I think it's new. Schools I knew were starting to offer counseling, of not just counseling, kind of developing these healthy mind habits of young children as well.
Yeah.
Okay, well, that's good. And that's those are positive things to kind of finish the conversation about. Thanks again for coming in and sharing your experience and your ideas and some advice for people with us today. I appreciate it. Thank you again to consultant psychologist Sneha Agarwal Chaudhary for sharing her ideas with me today. She's based at Norvik Hospital. Also, please let us know what you thought about this episode. We're on the usual social channels as Nepal Now or Nepal Now Pod. Thank you again to Ujalo Radio for providing recording space, with technical support, as always, from Dinesh. Before we say goodbye, don't forget to follow or subscribe to the show so you don't miss the next episode. I'm Marty Logan. I produce Nepal Now, and I'll talk to you again soon.